All right, Dr. Chris Donaghue, welcome to the podcast. Thank you so much for joining me.
Hey man, nice to meet you. Thanks for having me.
This is a topic that it's weird in a way that I haven't done it because I've done a few episodes on female sexuality. I am a male, obviously. And I guess as part of Preconceived, I was trying to understand the other side perspective, so to speak. And then as I was thinking about this topic and it came up in my mind, I was thinking this isn't really something I talked about growing up, even with friends. A lot of this stuff about like anxiety about sexual performance or thinking about a lot of these kinds of things that really do factor into male identity, male maturation. Do you feel like this is a topic that doesn't really get as much airtime as it should amongst men as they're growing up?
Yeah, so sex still, even at this time in history, is probably one of the more anxiety-inducing parts of ourselves. And as a therapist, but also as a sex therapist, it's probably one of the more profound parts of ourselves. So I want us to talk culturally more about sexuality, but I also want us to talk deeper. I think culturally we are starting to talk about it, but not with depth. And I think, in fact, we're kind of perpetuating some problematic norms. So I want some of that dialogue to really be about bringing consciousness to sexual authenticity. Side note, it's also the one part of ourselves that's never mirrored back from our family of origin. So culturally, we don't really talk about it in our social circles, and then our family doesn't really reflect back or give us a healthy relationship to it. And then we're kind of just like thrown off into the world and we date and we're supposed to figure it out as we go. And in doing so, I think we cause a lot of harm for ourselves and other people.
Talk to me a little bit more in depth, I guess, about that depth piece, because
Sure.
what I'm thinking when you say that is there's a lot of talk about sensitivity, be sensitive about sexual things, communicate about sexual things, talk about your feelings more. But when it gets down to sort of like the nitty gritty specifics of sex and like what that intercourse experience looks like, that's where I feel like there was a lot missing, kind of, for me at least, in my education or upbringing or chatting with friends, definitely family. Is that what you mean in terms of depth, like talking about actual details as opposed to just kind of saying the right thing of it's important to talk openly about sex? Okay,
So glad you're
that's
asking
why
that.
that's why the show's called Preconceived, because that was my preconception. Perfect. Okay.
I had a similar upbringing, and so when sex was talked about, it was only discussed as though it's a transactional experience and there's a right way to do it. And if at all, it was very anatomical and functional. If you said, "Hey, Dr. Chris, as a therapist, what do people really want?" I would say they want to feel like they're normal. What I really want us to talk about is who you are as a sexual being and look at sex deeply. And what that means when I say deeply is why I love being a sex therapist, because our sexuality tells so much about who we are in our sexuality, in the kind of sex we have, the kind of sex we don't have, how we have sex. It's our boundaries or lack thereof. It's our body esteem or the work we need around our relationship to our bodies. It's how much pleasure we can handle or tolerate. Our trauma shows up in there. Our communication skills or lack thereof show up. So I really work powerfully with my clients on understanding how their sexuality shows them what their psychological work is at large and vice versa. And can we move away from trying to perform it the right way, the normal way, make sure my partner's enjoying sex or getting off? And instead of trying to be normal, can we just help you be your authentic sexual self, which might mean you don't enjoy penetration, which might mean you're more focused on other aspects of sexuality. And so it really starts to move us into some of the more creative dynamics as well.
I'm glad I clarified, because that's not at all what I was saying.
You had a preconceived notion?
But what you're talking about is more interesting, and I want to get to some of the things that I was implying of like what is the normal, because a lot of people do come in and ask those questions, and I think people are interested. But let's start with kind of what you think is the deeper stuff and what you just said. Who are you as a sexual being? And some people listening to that might say you can really derive all that or interpret so much from sex, and they might be a little bit surprised by that.
again, I'm a therapist, and so my work is very much tailored to the person before me. And there's a couple different exercises we use diagnostically within sex therapy. For instance, when I travel and I lecture, I'll stand up on the podium and I'll say to them, I'm a man. And I'll have men do this thing that we call body mapping, which is a really interesting exercise, kind of deceptively simple. And I'll say, draw a body. It could be a stick figure. I'll say, draw a stick figure. And then I'll say, circle on the stick figure the areas of your body that you'll allow to be seen or touched or utilized within sex. And a lot of guys will just circle the crotch. And I'll say, isn't it interesting as I stand there talking about this, how from my head to my ankles is vast geography of body. And yet men will reduce their total sexuality down to their penis. And I'll say to them, we've been led to believe, for instance, that our penis is an erogenous zone. Our whole body's an erogenous zone. Our whole body's innervated, meaning our whole body can derive and provide pleasure for self and other. If someone rubs my arm just in the right lane gently, that feels really good. Why is it that we reduce our bodies down to those specific areas? Why is it that the random client might actually circle a few other areas and say, I love my ass played with, I love my thighs engaged, I like my feet touched, licked, played with? I'll say there's body shame tied in that. There's homophobia or heterocentricity tied in that. Isn't it interesting how we take your body, which is just this neutral geography, all of it able to derive pleasure, and we start dissecting it and giving right areas, wrong areas, that's gay, that's straight, that's too vulnerable. And we start to look at why. And I work with that individual with the goal, ideally, of being able to use the whole body sexually, or even just an inability to communicate to a partner. I like this odd thing. I like my feet played with, they might say, right? And just in that discussion, hey, sir, why are you not able to tell your partner that? We start to uncover that maybe their partner is shaming, or they're in an abusive relationship, or that this client needs to work on just giving voice to authentically the being that they are, but maybe in their family of origin, they've been shamed when they spoke up.
I'm curious, when you start bringing this up and mentioning it to patients, and you try to let them at least be aware that they could extend the boundaries of what sex can be. Do you find that the biggest barrier at that point is embarrassment and shame because it isn't really following the status quo?
I would say the status quo is probably one of the most toxic concepts that we have, because I think most people are very much their entire lives, what they wear, even the jobs that they'll take, are very much guided by that. Most people in our culture operate from conformity or authoritarianism. They either operate from doing what everyone else is doing, which is all about norms, or what they've been told to believe. Neither are really about truth or authenticity. Rarely in our culture are we really told to go after what makes sense to us. Our entire childhood is about adaptation to norms. Our parents want to raise us in the way that they feel is correct. They don't want to have us do anything that's weird. Then we become teenagers and we very much have our identity tied to what's cool, aka what everyone else is doing. And then we become adults and we have distanced so far away from who we are, right? But there's something really powerful that happens when people do the work, if they choose, on bringing more authenticity and confidence to their body and their sexuality. There's something very liberatory in that work, because culturally we've made it such a site of shame and silence that to tackle that, you can tackle so much more.
You mentioned there that you can kind of, if somebody, I guess you didn't use the word sexually liberated, but let's just use that word for simplicity. Somebody comes to you and they look at sex a different way, that they can walk through the world in a different way. Make that link for me about why, if you are sexually comfortable and authentic in how you approach sexuality, how that's going to approach kind of the way you live in the world. And it's weird because I'm thinking about something as I say this, and it's probably a concept you hate, and it's called big dick energy, BDE, which I'm sure you've heard of, which people talk about, like that person gives off this vibe, basically, that they've got a big dick, a big penis. It sounds vulgar me saying that, because as you're saying that, I was kind of thinking about this, what some people might be perceiving of this aura of somebody who walks around very sexually confident,
Yeah.
and what society at large would frame that as is maybe BDE, erroneously, I'm sure. But
Yeah.
make that link for me.
Or BPE, big penis energy.
Yeah.
Bad joke. Bad joke. Um, so I love this thought, and a couple answers to what you're asking. The neurobiological answer for the science geeks out there is that we all have this concept called the window of tolerance. And what that really means is how much anxiety can we manage and tolerate? And I usually make my hands like this. And I say a lot of therapy is about pushing the ceiling a little higher, making one able to tolerate a little bit more anxiety. What does that mean? Well, the idea of going to your boss and asking for a raise. Different people have different levels of anxiety and imagining doing so. And if I was working with a client that wants to do that, we'd work on pushing their ability to tolerate just a little bit more anxiety. Learn how to help you master anxiety management and distress tolerance. And once we're building that up in another domain, we'll be able to apply that to that same anxiety and distress that you in that past couldn't tolerate. And now you might be able to. And then you kind of brought in this other really important concept of big dick energy. And I hate that. I do hate that because it implies that that energy is due to having a big dick and that you have to have a big dick to have that energy.
Mm-hmm.
And that isn't true. And I don't agree with that. And I think that creates a lot of conflict in the lives of many men I work with. How often should we as a happy couple be having sex? And I'll say, I won't answer that because I don't want you judging, comparing, or aligning with some statistical norm. That's great for those couples. I want you to have the amount of sex that makes sense for you too. How big is the standard penis? I say it doesn't matter because I don't want you again to compare and to try to align with or have feelings about how close or how far away from it you are. I want people to have confidence in whatever body they've genetically been born with and to find ways to still manage the sexuality and the social circles and the worlds they're in. I don't want them to be relying on that. Because, side note, some of the clients that I work with that do have larger penises and whose confidence and self-worth are dependent on or reliant on that really struggle when they start to have erectile issues, which is an expected stage of aging in a healthy penis and will happen when we're having hard emotional times, financial issues, medications we may take. It's a very fragile thing to have your self-worth dependent upon. It fails you. If you ask anyone, what parts of your body do you not feel confident in? Sadly, most people will have an answer. Some people have multiple answers. And the truth is we shouldn't have any because the truth is it shouldn't matter because the truth is it's not a reflection of who we are, what kind of partner we'd be. When I'm working with people around dating, I say to them, a lot of the requirements you have on your partner, the ones that are about how tall they have to be, how much money they have to make, that also is the wrong angle to go because that, just like penis size, doesn't speak to what kind of partner they're going to be. Who are they going to be in times when you're struggling and you're depressed? What are they going to be like in happy moments? What are they like to sit at a dinner table with and talk about? Their penis size has nothing to do with that. Their height has nothing to do with that. Their income has nothing to do with that. So I think when we get obsessed with form and materialism, I think that's really the wrong direction psychologically for a lot of things.
It's interesting because what you're talking about is very opposite to what I was talking about when I made the false assumption about we don't get into the depth of what we're talking about. Because I was talking a lot about kind of, what is normal? Like, why doesn't somebody just tell us what's normal when we're younger? And I mean, part of me wants to and was planning on asking you, what is average penis size? How long does the average man last? How many times can an average man have sex in a sitting, so to speak? But as you say it, I kind of realize that it's kind of, what's the point? You're not going to grow your penis if if you're below the average. I'm trying to think about what women are thinking about and what are women talking about. And yes, you could say if a woman is just talking about that, then that's not the right woman for me. A lot of women, I imagine, do talk. And I was talking to a friend about this and I was surprised. I'd never thought about it and I felt so silly. She was like, "Oh yeah, of course we talk about penis size. We compare penises amongst like our partners and when we're going out. And of course we're comparing how long somebody lasted and all that and thinking
Yeah,
about those factors."
and FYI, dudes, the dick picture sending these girls, they're sharing like it's
Yeah.
nothing discussed. Yeah,
So
yes,
so
yes, that'll
the
be
man listening to
discussed.
this might say, like, that sounds all nice
Sure.
and dandy. But at the end of the
Yeah.
day, in this dating world, when there's so many men out there and kind of to get your sounds awful, to get your foot in the door, that's the wrong way of saying it. People are looking at some of these metrics. how do you completely ignore those? And what do you say when people come to your office and they're kind of stressed about that? They say, I imagine I have like an average sized penis, or like not one of the bigger penises, or I can't last for that long in bed.
I think it's a great question because we do have to live in reality. And that's kind of what you're
Yeah.
saying, right? That this is very idealized and utopian, but we don't all live in that world. And in Los Angeles, we are a very aesthetically centered, beauty driven gym culture and all of that. And the bar is very high and there's a lot of expectations. My joke is always, I'm literally lifting weights, standing next to the male model who, as I look out the window, is in his underwear on the billboard across the street. And of course, there's a comparative moment of like, this is what I'm supposed to be looking like. This is my competition in the world. I live in Los Angeles. This is what the men that they
Yeah,
look like, right?
exactly.
So it's these funny moments of like, you got to be in the world to some extent. And I don't negate that. I think it really becomes, on one hand, a discussion of how much do you want to cooperate in those worlds? And I think it's a question we all have to ask, because that comes up with my clients around their physical body and gym culture in LA, where they'll say, oh my God, I have friends that are going to the gym every day and then they're doing yoga for 2 hours and then they're doing a hot sauna and a cold plunge. And I say to them, yeah, that might be the standard, but to what extent do you want to cooperate? And I think with mental health, which the sexual topics we're talking about are directly tied to someone's mental health, meaning, a lot of women might also say, I want to only date a man that drives a hot car, a great watch, and makes multiple six figures. Do you want to cooperate in that world? And do you want to cooperate in those social circles? And what impact does that have on you when you do? And that's what my job is as a therapist is, if you are trying to participate in the dating world with a penis that doesn't align with the size you've been told you have to have, your mental health is going to tank.
That's a very practical answer, and I don't think you're overly idealizing it. I think you're giving a fresh, broad perspective, and like it is true. Ultimately, you don't want to be dating somebody who cares so much about those factors, especially the ones that are impossible to control.